Zimbabwe currently has 34 confirmed cases of COVID-19, and today, to give us our daily update of where the country stands, I have the Permanent Secretary in the Ministry of Youth and Child Care, Dr. Agnes Mahomva, and we are also joined today by the WHO country representative, Dr. Alex Gasasira. Good morning. Dr. Mahomva, maybe you can just start by giving us an update. Where do we stand right now as a country in as far as the COVID-19 pandemic is concerned?
Thank you very much for that question. Let me start with the numbers that we issued last night. I'm happy to say our testing strategy, intensified testing strategy, we've continued to see the numbers that we're testing go up. Last night, for example, we reported over 1,400 cases, and most of them were PCR. We're very happy to note that we have tested more, and yet our positives remained at 34. That is good news. I would also add to say that 34 have remained there for a little over a week now. We are excited. We're waiting to see if it remains there. And then, of course, we'll reanalyze and see what it means for us.
All right. Coming to you, Dr. Gasasira. As the WHO, are you happy with these numbers? It has been over a week with Zimbabwe at 34. Is this a good thing or?
Thank you very much. The World Health Organization guidance to countries is to do everything possible to identify any suspect case, to test, to isolate, and treat. So we are happy that every effort is being made to intensify surveillance. We are seeing increasing numbers of samples reaching the lab, as the Permanent Secretary has informed us, but we are also seeing these samples coming from all over the country. We are seeing efforts to identify people with respiratory illness. We are seeing every hospitalized patient being tested. We are seeing efforts to ensure that all contacts are identified, followed up, and those who become symptomatic tested. All this is in line with what WHO recommends, and we are very encouraged by this. The fact that there have been no cases for the last week should not stop us from continuing in this direction. We really encourage that these efforts are scaled up even further.
Still on you, Doc. Recently, when the government announced that we're now on level 2 lockdown, they said that it should be mandatory wearing of masks. And there have been different types of masks people have been putting on. We've got this mask that I'm putting on, I don't even know the name, and the one that I'm putting on, which is a cloth mask. Which type of mask should people put on?
Thank you very much. Again, we were very encouraged that as the government is looking at adjusting the lockdown, they are doing this in a way that is comprehensive, that is evidence-based. And one of the actions that has been recommended is wearing a face mask or face covering in public, wherever people cannot maintain physical distancing. Face masks can reduce the amount of secretions that are shared when somebody talks, when somebody coughs, when somebody sneezes. Mm-hmm. Now, ideally, the medical mask, which is the one you're wearing, is more effective than the cloth mask. But because of the global demand for medical masks, they are not enough to go around. So, WHO recommends that medical masks are used by people who are caring for symptomatic patients, because those who are caring for symptomatic patients are at highest risk of getting infection. Okay. And these could be people in the community, if you're looking after a family member who is sneezing, who is coughing, or health workers in health facilities. So those should get the priority for the medical masks. Mm-hmm. But a cloth mask like the one I'm wearing can also limit the amount of secretions. In case I am symptomatic, I cough, it protects the people around me, especially if we can't maintain that physical distance of 1 to 2 meters that's recommended. So the recommendation by the government for wearing of masks when in public places is really a welcome development. However, I must add that a mask alone is not protective enough. Masks must be used together with hand hygiene. As we were entering the building this morning, we saw the people giving us sanitizers, monitoring our temperature, And staying away, if I'm sick, I should still stay away. I shouldn't come out because I have a mask. No, we should take all of these together. And in that way, we will limit the amount of transmission.
All right, Dr. Mahomva, coming back to the issue of the numbers at 34. Sometime last week, we had, there was 6 more people were said to have been tested positive. We were at 40, then we came back at 34. Maybe you can just briefly explain what really happened, what transpired. Can we still trust the results coming from your lab?
Absolutely, you must trust it because we did everything we could. The idea is when you're running your samples or you're collecting your samples, there's specific things that you look out for. Following our standard operating procedures, you know if something like this happens, you must redo or you must do X and so on. This is exactly what we saw. We saw that there was unusual cluster of 8 cases that came from one plate in the lab. Then we knew there was something wrong there. So looking at our standard operating procedures, our quality improvement, quality assurance processes, that's when we're saying we have to retest those and really confirm. So we did that. We didn't just retest the samples. We actually went and resampled the same individuals, then rerun vigorously, carefully, following the QA processes that we have already, and these are also guided by WHO guidance and so on and so on. And that's when we confirmed, no, these are actually negative. So we're very happy because we picked it up immediately. If we had picked it up a month later and so on, you could doubt our system. But because the process, the standard operating procedures, we were following them and we picked it up, immediately rectified, you can continue to actually trust our labs. The people there are experts, they know what they're doing, and the machines are serviced, everything is coming out. It was that clustering that we saw that could have had some contamination there, and then of course we rectified it. I'm very glad you're asking because we at the moment as a government, we're focusing on making sure, as WHO has said, really intensifying our testing, ensuring that we're having more PCR testing for confirmatory diagnosis, and making sure that when we do run them, we're running them properly in the context of a comprehensive package, i.e. we've intensified our sampling, testing, we've roped in the uniformed forces to make sure that we're doing more PCRs in their hospitals, their personnel, the healthcare workers, the patients, to ensure that our surveillance is really picking up the numbers, to ensure that we are then able to inform our response and ensure that we're on track.
All right, Dr. Gasasira, you mentioned the issue of masks, right? And then, so what's the proper disposal of masks? And then looking at face masks, cloth masks, the washable ones, how should people take care of these masks?
Thank you very much. So, disposal of face masks is really very important because this could be inadvertently another source of infection. So if you are using a disposable mask, the right way is to take the mask off from behind, ensure that you don't touch the front of the mask, and dispose it in a safe place which nobody else will have access to. If it is a reusable mask, like a cloth mask, again you take it off from behind, don't touch the front, don't touch the part that you have been breathing into, and then immediately wash it with water and soap. And only after that, and then dry it very well, and then if you have the possibility, iron it before putting it on again. So the act of disposing a mask is as equally important as the act of putting it on. And again, to emphasize that the mask should always be used together with regular hand hygiene, with, to the extent possible, observing the physical distancing, and if one is unwell, to stop going amongst others.
Okay. Dr. Mahomva, we keep hearing of the W curve in infection rates from countries which have implemented lockdown and unlocked. What is it? Do we also risk it? Where do we stand as a country in as far as this curve is concerned?
And as far as the ramping up of cases or the curve that people have talked about, we are very aware when we talked with our modeling experts looking at our current data, and in fact we're working flat out with them now that we've said our numbers are going up. They have picked up the total numbers, the numbers that are going up, and put them in the model to see for Zimbabwe, where are we, how is our curve going to look like. And they have basically told us it looks like it might be shifting a little bit to the right. And of course, they are the scientists who are listening and seeing. But the bottom line is they are actually also convinced that our numbers are going to go up, and hence we need to intensify the comprehensive package that we talked about. First of all, prevention, washing our hands with soap and water, making sure when you're coughing, you have your mouth covered, and so on and so on, and making sure that we're also doing that massive surveillance, ensuring that we are able to detect, to find the suspected cases, make sure that we test them, PCR, confirm the numbers, and then they feed into their modeling. But most importantly, they feed into our programming, where we're able to say we can trace these numbers of these positive cases, we can admit these severe cases, we can manage them, and so the whole thing is actually a chain. It's a package. It's not just about the numbers, it's not just about the curve, it's not just about isolation, it's a whole package. Prevention first, washing your hands with soap and water, making sure when you cough you cover your mouth, you're wearing a mask, and so on. And those who are in the healthcare workers managing cases appropriately if we get the numbers. That's basically what we can say. Always looking at the comprehensive package, and not just a curve, and not just the numbers confirmed, and not just in silos like that.
Recently, the government announced that we're now on level 2 lockdown, which meant that industry and commerce and some businesses are now operational. It's no longer about essential services coming to town, going to work. And then the Ministry of Health introduced mandatory testing of staff by their employers. Is this feasible?
This is actually what was pronounced by our president on Friday last week, if you remember, where when the lockdown was actually being extended, those are the measures that he said. Looking at industry and commerce, those were coming back to work, reopening for the first time during the lockdown. That was the condition that was put in place, that they should first of all have their employees screened to see where they stood. But we're very happy that just last night the cabinet really looked at that and relaxed that bit. It's now really speaking a bit more practically, comprehensively, very much in line with the comprehensive package that I talked about. It's not about just screening. The screening test that we were talking about, that we were indeed giving guidance in terms of what the employers, the businesses can do, are really just to emphasize their screening tests. They do not give you that confirmatory test. It's the PCR that we have been pushing so hard, and we're continuing to do so. But having said that, the rapids do have their place. We've always been using them to screen at ports of entry, to really see where those who are coming, the returning residents, stand. And then, of course, if one has symptoms and signs and so on, they're immediately going to have the PCR test. And, of course, if one happens to turn positive with a rapid, they also must have a PCR test. So once again, I want to emphasize, it's really about the comprehensive package. We're so delighted that as we're speaking, as we're moving from today, companies, we are encouraging to say, absolutely, when people come to work, you must screen their temperature, you must check if they're coughing and so on, and those that can be prioritized for the PCR testing. So they now fit into that testing strategy that we announced sometime back, to say we're really ramping it up, we're intensifying it to make sure that we pick up, we detect the cases that are confirmed, and we run with it. So companies out there, we encourage them to say, please do the screening, take that little history as people are coming. If they have the signs and symptoms, make sure you then refer them for PCR. And those particular labs that we said could actually support us. The big ones, we are fast. Yesterday, for example, Lancet, I think they went through. Yes, they did go through their assessment by ourselves, Ministry of Health and WHO. They're now going to be doing PCRs for us. So we're saying companies out there, watch out for that, to make sure that as you are screening, has been now announced yesterday, temperature, coughing, and so on, those that require to be tested using PCR, you must make sure they do that.
businesses, well, we can just say most of them are interested in profits, in profiteering. Is the ministry doing anything to check on compliance? Are they complying to these rules and regulations?
We do actually. That's our big work, is to really go out there and see, okay, we said this is a designated place. Do they have a qualified, registered healthcare worker who's running it? Because remember, as I said, if you're screening, if you happen to do rapid testing, then anyone who gets positive must have a confirmatory test, because the rapid tests are just that, for screening. And hence we want to make sure that they're looking at the comprehensive way of screening their employees. They do the temperature check, they're taking a bit of history, are you coughing and so on. If they use a rapid test, if it happens to be positive, they must make sure they have a PCR test and so on. So that's where we stand, that's what we're encouraging. We're saying, well, a few days ago we seemed to focus so much on rapid testing. That was really not the intention. It sounded like we had sort of left out or dropped our usual comprehensive package, which speaks to also doing PCR testing. That's what we're talking about. Our testing strategy is not just about the numbers tested. It starts way back. Have you screened the people? Have you asked them about their cough? Have you taken their temperature? And so on and so on. If those are there, you do the PCR and you go on to link with our rapid response teams to ensure that contacts are chased up. You go on to link with the hospital if one is positive and they need isolation. It's a comprehensive package. We might sound like we're speaking here only. That's perhaps at that time, based on what is really needed to do immediately. But we never forget the comprehensive way of dealing with this, because if we don't do that, we will struggle if the numbers go up.
Dutifully, employees pay their medical insurances, and the employers also cushion the workers. But the medical aid companies, where do they stand in as far as the COVID-19 pandemic is concerned? Seeing that now there is testing at workplaces and stuff, where are they? There seems to be a deafening silence.
They should be very much part of it. Just like we're saying, everybody in Zimbabwe, this is something for us all. Everybody's got a part to play. Medical societies, this is where they should step up. Because if one has got to go and be tested, they should be able to use their medical aid as well, card and so on. They should also continue supporting us as they have done in the past, giving some education. We've got materials that we've shared with not just the public, but also including the medical societies. As they do the advertisements, they should also be talking about what people need to do. That comprehensive package, once again, that supports us to be able to do our surveillance, to be able to detect early those suspected cases, to be able to test them using PCR, to be able to then follow up our contacts, to be able to manage the cases. Medical aid societies, they can run with it through that whole process, that comprehensive package, including their very core business of supporting and financing those who need their support.
And then coming to you, Dr. Gasasira, as the World Health Organization, are you happy with all these measures that the country is taking as we compare with other African countries and how they're doing it and what they're doing at this juncture?
Thank you very much. So, actually, the World Health Organization recommends that a response to COVID-19 should be an all-of-society response. We are very happy that the government has not only stopped at ensuring that this is a whole of government that brings together the different government ministries and departments, but has reached out to ensure that this is whole of society. As the Permanent Secretary has highlighted, everybody has a role to play. Individuals, communities, businesses, non-profit organizations, all of us have an important role to play. And we're happy that this is being pursued aggressively in Zimbabwe. We see this also in other African countries. The intensity and the range is variable. Some are doing it equally aggressively. Others could do better. Every country is different, and every country is responding in the context. So we are happy that what is happening here is in line with what the guidance that has been given. Earlier this week, the International Health Regulations Emergency Committee that meets to advise the Director General of the World Health Organization met and looked at the data from all over the world, including from sub-Saharan Africa and from different countries. And one of the recommendations they made was that countries should start documenting their experiences and sharing them. Where things are working well, this should be shared so that other countries can learn from them. Where they are having challenges, they can learn from other countries. We are all in this together. We are all learning together, and this is something that we hope that we can work together with Zimbabwe to document and start putting together our lessons learned.
Oh, thank you very much, Doc. You heard what he was saying. It is a novel disease. It is a novel virus, and everybody has a role to play to flatten the curve. You play your part, I play my part.